It is important that you know that your physician has the extra training, was able to pass a 2-day examination.
Okay, in other words, you know that you get a person who is completely qualified.
That's correct.
Right. Now, the role of the family practitioner is very important. And, you know, once we had our own family doctors and they did house visits or home visits, and it was something, you know, very unique, and I'm really sorry that we've lost it. But we do have practitioners like Dr. Tomio who extend themselves beyond just the clinical, you know, examination that people will get. But what is the difference, and what is the role of the family practitioner?
The primary role of the family practitioner, as I stated earlier, is a patient advocate as well as the primary caregiver. We also serve as educators, and we discuss pathology or disease process, as well as educate in medications, pharmacies, place a heavy emphasis on diet modification, weight reduction, exercises, as well as look at a patient holistically, not just from a specific disease process, but holistically the entire patient, from like our patient we'll discuss in a few minutes. We can start from the pediatric population all the way to geriatrics. So we're highly educated, we're highly trained. We look at the patient as complete whole, and we handle all sorts of and varieties of pathology.
Right. Now, you're my family practitioner, and I'm really blessed to have you because I've been to a lot of doctors and clinics and whatnot, and you go in for one thing, and that's all they will treat you for, and they'll give you a prescription, and they'll just go here, take this and that's the end of it. So you don't know why you're taking it, you don't know what it's going to do to you, but you know, that's as much as you're going to get out of them. But that family practitioner, I have learned through you, is different. And I just want to go back and, you know, and just take my case coming into you and give our people a walkthrough on exactly what is the proper role or the proper actions or services that a practitioner should take.
Okay. Well, first and foremost, you have the patient, they enter your office, and you want to develop a rapport. It's a relationship like any relationship, whether it's your family or employee. Here we would have a physician-patient relationship. The key here is, one, to develop a open communication, so we have a dialogue. It's very important so that the patient feels comfortable and they're able to express their feelings. If you don't have a good, strong relationship with your physician and the physician with the patient with the physician, you will never really fully understand the patient and their pathology, and then the patient will feel very uncomfortable to offer information so the physician can make the appropriate decision on how to treat pathology if it's warranted, or to even refer the patient to a specialist.
Now, the family practitioner, the person comes in, and they may come in because they, you know, they got some symptoms. They want to see whether this is maybe the flu. Okay, do you just look at that, or do you expand to really look at the history of that family, other things that might affect them, other things that they may have that they don't have? And do you take time to, say for instance, to read the diabetes chart with them, or the high blood pressure chart, or even the cardiogram record? Do you do that?
Yes. Again, if this is the initial first time that I'm seeing the patient, I'll do a thorough history and physical. We'll sit down, I'll ask about past medical history, any allergies, and past family history, because that's very important. A lot of times that will give me a clue to where they're going and leading, or the potential for pathology down the road, or disease process. With this in mind, I take the same information and I give education, and we sit down and discuss for possible intervention to try to, what we call preventative medicine, to try to decrease the risk for developing pathology.
Okay, very good. Now, we're talking about the age for primary care. What is the age for primary care?
Okay, the age limits for a primary care physician, now this is all based on insurance companies. With my training and as well as other primary care physicians or family practitioners, we are trained, highly educated to see the full spectrum of medicine, meaning from prenatal all the way through delivery up to geriatrics. That means you're senior. So I can treat the full spectrum of medicine. I'll give you another example would be with Medicare. Medicare, I can see patients from prenatal all the way up to adulthood. With your managed care or your private insurance companies, a lot of insurance companies will have restrictions, and they will request that family practitioners see from 4 years of age and older.
Now, many times you have to refer individuals to a specialist, and how do you select or special? Are you just making referrals, or do you make sure that the specialist that you're sending to them, is equal to your service or better?
Right. Depending on the pathology and the needs of the patient, if it's necessary and warranted to refer to a specialist, I will pick a specialist that has a similar personality to mine, similar background, and they'll be board certified. It's important to me because this person who I refer to represents me indirectly. So if my patients are happy, they're going to feel comfortable with me, and they're going to, as well as with the specialist. And we're going to, both of us, myself and the specialist, are going to provide the best care for the patient.
Right. Now, at AllMed, what is your position at AllMed?
My position at AllMed is the primary care physician or family practitioner.
Right.
I coordinate the care of all the patients who come in for primary care. Again, I would be their mentor, almost like a family member,
Right.
someone who they can consult. I can discuss pathology, preventative medicine, as well as external stressors such as family. My role is also as a counselor, as well as employment issues. I can discuss if they're having problems at work, and that becomes the social aspect of medicine.
Okay.
So I coordinate in
So it's
like a
pretty
holistic,
holistic.
yes, a holistic approach.
All right. Now, we want to talk about prevention and wellness because many doctors are not interested in prevention because you don't make a lot of money out of prevention. You make it out of treatment, and we know that. And many people are on treatment for years, and without anyone being considerate of preventing, what could happen or what could get worse or what they call proactive. Okay. Now, how do you differ as a practitioner? And when I speak of you, I mean AllMed in dealing with prevention and wellness.
Yes, the way I was trained from college through grad through up to medical school, my approach has always been proactive, preventative. If we go full force and sit down from the start and address issues, the issues could be diet modification, weight reduction, exercise. We can decrease as many risk factors as possible to try to prevent disease in the years down the road. However, if there's like we say, genetic predisposition for a disease, I cannot change that with all the education in the world. However, I can address risk factors that are preventable, and that's what we should do. And what I do is I place a heavy emphasis on proactive, where I address prevention, preventative care. And that's with education, like I said, diet modification, weight reduction, educating the patient, what are risk factors, what are the risk factors, and how to reduce these risk factors.
Now, when I came to see you the first time, and there was a lady sitting there, and she was raving about how you helped her, and it was basically in developing a healthy lifestyle. You want to share with our viewing audience, that particular patient without giving names,
Right.
of course. Yeah.
That particular patient, as mentioned earlier, had a history of hypertension and diabetes. She came in initially with uncontrolled blood pressure as well as her sugars. I brought her in, did a complete history and physical. We went through the blood work. We did a baseline hemoglobin A1C to see where her baseline was, and I